Record. Good afternoon, everyone. My name is Dr. Carlos Perez. I am pleased to host a special presentation on self-care. Self-care isn't selfish. I'm going to let my panelists introduce themselves, and I'll come back later. Have a great day.
Hi, everybody. Welcome. So glad you are here. My name is Dr. Eric Thompson. I'm an assistant professor here at Nova Southeastern, teaching in the counseling department. And so self-care, wellness, is one of my passions. And so I'm happy to be here sharing this with you today. I brought a few people along with me, so I'll go ahead and share who you are.
Hi, I'm Dr. Isabel Thompson, and I am an associate professor with the Department of Counseling. And I'm also a licensed mental health counselor in Florida. I'm really excited to be here today, and our team really value this topic, and we're so excited that you all are here to delve into self-care, especially during our current situation with pandemic stress and kind of reopening stress some people may be feeling. So welcome.
Hi, everybody. Welcome. My name is Catherine Ivy. I am a third-year doctoral level school psychology trainee, and it is such a privilege to be here today and be able to share with you all one of my passions. I love enjoying and sharing about self-care, and so I'm excited to be on this journey with you all.
Hi all, I'm Catalina Uribe, and I'm also in the school psychology doctoral program. On top of that, I am this year's Student Government Association president, and one of the initiatives that we've really tried to kick off this year is how to include more self-care, especially during these times of COVID when we're all feeling a little bit isolated, we're all feeling Zoom, overloaded for sure. And we're just feeling all types of things that I think that self-care is super important in order to combat them. I also really have found a passion in convincing people that self-care isn't taking the whole day off and taking this magical, perfect vacation, but rather it's all the little things that you can build into your routine that kind of keep you going and recharge your battery.
Exactly. So one of the great things about approaching self-care and wellness is that there are so many different ways to do it. And so I think depending on really whatever walk of life you're coming from, there is something there for you in terms of self-care. You don't have to be this serious meditator sitting on a rock nonstop to be effective at caring for yourself. So I'm going to move this slide here. Okay, so it's an hour-long presentation here, and so we have a pretty ambitious agenda. Hopefully we didn't pack it all too much, but we're going to cover some of theoretical frameworks of self-care, going over some of the theories, some stressors that are common to the pandemic and re-emerging from them, self-care as burnout prevention. So those of you who are clinicians or are just experiencing burnout, this is for you. We also are going to talk about self-care plans, and we're also going to do some experiential, contemplative approaches to self-care. So looking forward to this seminar. So we can start by pressing our inner like button. That's kind of music. Well, I'm going to keep going. All right, and I believe I'm going to hand this over.
Mm-hmm. Yes. So the first thing we want to do for this presentation is just to have you set your intentions, right? There was a reason for you to register. There was a reason for you to attend, because I know we all register and then don't attend. Things pop up. So while you're here, just reflect on why is this important to you? And how might this fit into your values? Talking specifically about self-care, about taking an hour or even just 5 minutes for yourself to either improve your knowledge on something or to do something that's extremely relaxing. And then again, we want to continue defining self-care. So by the book, self-care is described as the application of a range of activities with the goal being well-functioning. And this is described as the enduring quality in one's professional functioning over time, and especially in the face of professional and personal stressors. It's also been defined as a way to basically replenish the sources that sustain you. I think that everybody at this point in time has probably heard the phrase that you can't pour from an empty cup. And so again, as I mentioned in my introduction, self-care is all of the little things that add up to making us feel like we can tackle all the challenges that come with either being in graduate school or working or just, surviving this quarantine period in our lives. So as our focus is about helping ourselves and about helping others, depending on what role you play, whether you're a friend, a mentor, a professor, or an educator, really in any setting, we want you to reflect on these kind of questions. The first one is about yourself. What approaches are you currently using in your own life for self-care? Is it maybe spending the first 10 minutes of the morning after waking up without looking at a screen? Is it engaging in something more contemplative, like a meditative practice? Or is it maybe taking a break in the middle of the day, shutting off all your screens and taking some time to enjoy the beautiful South Florida weather, or wherever you are, hopefully there's good weather? Do your current self-care practices reduce your stress level and enhance your wellness? If you were here for our pre-presentation chat, I was mentioning that one of my self-care activities is to make earrings out of polymer clay. I also sell them. And so sometimes it ends up feeling more like a chore because I feel like I'm on a deadline. So maybe in that moment, it's not really self-care and it's more like a job. And so just think about how you're feeling in the moment, how you're feeling that specific day, and what is the thing that can actually help you feel better in that specific moment. Are you longing for more ways to effectively integrate self-care for your clients and yourself in the current context? So or do you feel like you might not be doing enough for maybe the students that you teach, the students that you work with, or just colleagues, maybe even your family members if you're a parent? The one thing to consider is, of course, we're all experiencing this pandemic. We're all experiencing these negative feelings. And so we do have to alter our feelings of enough because there's only so much that we can do with all of these added factors. But if you are longing for that, then this presentation is perfect for you to listen to. So we're glad that you're here. Now talking a little bit about how we can help others, what issues do we see our clients or students bringing to us? Are they really overwhelmed with the load of work that they have? Is it all the hours that they spend in front of a computer screen? What are the specific problems that are coming up in your life? And what connections can we make between the problems and the engagement of self-care? So if a student, for example, comes to you and says, I spend 9 hours a day on my computer, and then after that, I have to work on my research assignment, and then I'm, have to submit this paper. And you ask them, well, what are you doing in between? What are you doing afterwards or before to kind of prepare and center yourself and take care of yourself? And if they say, oh, self-care, I don't have time for that, then you know that there's a little bit of a disconnect there. And then you might want to introduce some helpful strategies to be able to, again, cope with that stressor. Finally, the last question we want to talk about is, what support and resources do you need within your specific context? So again, not all of you are joining us from the NSU main campus. Not all of you are joining us from an academic setting. And so thinking about whatever setting you are working in, what are the self-care practices that you can introduce? For example, if you're working in an administrative building and you have weekly meetings, is there 5 minutes that you can take to do a calming activity at the beginning or the end of that meeting? Are there breaks that you can implement, like staff wellness? So maybe having muffins at the next staff meeting, little things like that might increase our happiness and essentially our self-care and wellness. Okay, so talking about theoretical frameworks, we, as this team that is presenting, follow the Indivisible self framework. This is the IF5 well. So it's a theory of wellness that basically says we are one indivisible self that is made up of 5 different mini selves. So we have the creative self, the coping self, social, essential, and physical. All of these selves are also composed of 17 subcategories. So for example, it's a little bit hard to see, but for the creative self, you have aspects of thinking, emotions, control, work, and positive humor, right? So little elements that help fulfill these categories that help us feel well as our indivisible self. This model also exists in different contexts. So we have it at our local level, within our family and our home, in our neighborhood, and then in our community. We have it at the institutional level. So maybe in education, religion, government. So these are kind of like the policies and laws that exist in the world and environment in which we live in. Of course, we have global considerations. So in this moment, again, we're living in a pandemic. And what does that mean for the indivisible self and for all those factors and the way that we fill them? Lastly, there's also chronometrical. So this is just to say that the indivisible self and the way that you might fulfill your needs at this point in time might change in the future. They might change with age, with experience, with the environment that you find yourself in. So it's just important to keep in mind that as your needs change, your self-care routines might change. So again, going back to the earring example, what might have worked for me one week with making the earrings might not work for me another week. So it's just important to keep in check with yourself to see how you can really and truly better help yourself.
Yeah, and just to kind of add to that very briefly, someone mentioned in the comments that they like to tell people to take kind of small increments towards self-care, and I think that's a really smart and effective piece of advice. When we're doing self-care, one of the things I like to focus on is what's called seasoning the day. You know, you heard of seize the day, but what about seasoning the day, where you just kind of throughout the day just sprinkle a little self-care, a little meditation, a little whatever you need. Part of that is checking in. And then you'll find that throughout the whole day, you're kind of just taking care of yourself and you're putting not too much effort into it.
Mm-hmm. And speaking to that, you know, if you don't practice self-care right now in any way, don't expect to have this perfect plan of, you know, being a self-care guru. Start small, because if not, it's kind of like when you stop working out and then you go to work out and you have the same plan as when you were the most fit in your life. And then you leave the gym not completing it because we're not at the same level. And then you feel kind of like a failure. So you want to set up for success. And so you want to season the day. I love that.
I love that too. And one of the things that you guys emphasized was that how you practice self-care is going to be individualized to you, and what works for one person might not necessarily work for the next. And this goes for the same way that we cope with and experience stressors. One person's experience isn't going to be the person next to theirs. And so, you know, some of the common and current stressors that have been a theme throughout this year is not only the COVID-19 pandemic, but also the associated stressors that come with that. So such as concerns for health and safety. This might be an immediate family member or a family member or a friend, the individuals in your workplace. And so other stressors from this year include civil unrest and social justice advocacy movements, other types of stress inclusive to school and work. And it's important to think about the intersectionality that happens among these as well. So it's not just putting each of them in a box, but thinking about how they interact with one another. And two, how one stressor, it can reactivate traumas from the past, and you can also have vicarious traumas from a close other or a family member or a friend. And so it's really important to not isolate these issues, but also give yourself the understanding that many of these stressors interact with one another and can build up to create a more bigger level of stress, in addition to those traumas from the past or stressors from the past that could be brought up to the present. Okay, so some clinical issues related to quarantine and isolation. One of the studies that I wanted to share with you guys comes from Johns Hopkins University, Bloomberg School of Public Health. And there was a new survey conducted during the COVID-19 pandemic, and they found a more than threefold increase in the percentage of US adults who reported symptoms of psychological distress. So this number, it went from 3.9% in 2018 to 13.6% of individuals experiencing psychological distress in April of 2020. And I think about how even then, some of the things that we discussed from the slides before are things that are still present. They're things that we're still experiencing, still coping through, still trying to navigate. And so when I think about that number going from 3.9 to 13.6, I think it will be interesting as time moves on to see how those numbers change. And so inclusive to distress and some of the clinical related issues with quarantine and isolation could be delirium, depression and anxiety, PTSD, pre-existing psychiatric disorders. So one of the things that we mentioned were not only those stressors that are accumulating and exacerbating current levels of depression or anxiety, but also past experiences. It's important to think, okay, what was your level of functioning before these things happened, and where are you at now? Taking into consideration substance abuse disorders, cognitive disorders, and other special populations. Okay, so moving on to factors likely to cause psychological distress returning to school and work. And right now, many of you may be returned back to school or back to work. Maybe you have a flex schedule, and maybe some of us are working full-time from home. So this might be the perception of risk to yourself. So everyone is coping with this pandemic in a different way. And so this really speaks to your own perception of the COVID-19 pandemic and the ways that you are individually coping. And it's important to note that it's going to, again, affect every single person differently based off of their experience. You know, someone who has been impacted maybe personally, maybe by a family member, it's going to be different from someone maybe that has been impacted in a different way, or maybe hasn't had any contact with COVID-19. And so in addition to that, it's important to think about, again, the impacts of COVID-19 on their work life, and especially as we move back into the workplace, thinking about the perception of risk that is associated with that. You know, someone who feels really comfortable going back into work, maybe that is not going to be the same case for the person or the coworker next to them. Also thinking about depressive affect and engaging in a high-risk environment. So these are some of these associated features with the COVID-19 pandemic that one person or another may be experiencing based off of their perception of their risk. Okay, and then here is a brief list for 10 COVID-19 anxiety reduction strategies. So I won't read through all of them, but just a few that I can list out are media distancing. So we know that many stressors associated with, or an anxiety associated with the COVID-19 pandemic can be exacerbated by primarily getting your information from social media. So at some points, it could be beneficial to do some inward reflection and say, hey, am I spending too much time on the media? Is this primarily where I'm getting my sources of information? And so maybe taking a step back and taking a break from media and coming back with a renewed and refreshed perspective. Let's see, another one, do not react to physical symptoms. So allergies, bronchitis, and cold that are more common COVID-19, scanning your body, looking for symptoms, reinforces your worries and will increase anxiety. So being able to, what this means here is being able to know your typical symptoms for allergies or maybe the common cold, scan your body and be able to identify, okay, is this something normal or maybe this is something that is abnormal? And what the research shows is by being able to do that in a way where you're being able to do that, it can decrease your anxiety because you're able to be more mindful of your past experiences and being able to compare them to, okay, this is something that I felt before versus, okay, this is something new that I haven't felt before. And so maybe if it's different, that's when maybe I should be worried or go see my physician. And then lastly, the last one that I'll mention is be kind to yourself and others and have faith. So this really speaks to that community-oriented and socialization. So even now, one of the things that we talked about is individuals are having different comfortability levels with contact. Even now, with getting the vaccination, it's still important to be cautious, to social distance, to wear your mask, and people are going to have different comfortability levels accordingly. And so thinking about how we can continue to interact with our loved ones and friends while being safe, because we know that social support and social peace is so critical to our well-being. As Catalina mentioned earlier, it's part of one of ourselves. And so reaching out to relatives and friends who are isolated or in need. This has shown to increase our well-being, both their spirits and yours. So have faith that the storm will pass. Hope this is a really integral piece and part of our well-being. And so have faith that the storm will pass. Having faith or imagining the worst is a choice. And asking yourself, which one am I going to choose today?
Yes, exactly. And reaching out to people is so important. We were kind of had this little sub discussion on the chat. And feel free to jump into Catalina about how we have all these multiple stressors kind of adding up. It could be the stress going on. What was happening with the election a while ago. Things that are happening lately with various police shootings. With things that go on in your personal life, and when all those things add up. Self-care could be such a useful response, but it's also important to remember that, when you are stressed out, many people have a tendency to pull away from supportive relationships. And for some reason, we have a way to pull away from activities that are helpful, that are supportive to us. And so one of the things to do here is when things are adding up, when these multiple stresses are starting to take their toll, is to check yourself, maybe try to get some support. Talk to your friends, family, maybe go see a counselor or a therapist. It doesn't have to be a huge issue to talk to someone. It could be something's on my mind. I have a little anxiety I want to talk about. I have something that just isn't getting off my mind. It's not going away. So maybe I just want to do a quick check-in. And that's something that can be done as well.
Mm-hmm.
Did you have anything else to add, Catalina? Or?
Yes. If you're not keeping up with the chat, the one thing I'd like you to take away from is that self-care is kind of a deceiving term because it has the word self in it, but it doesn't mean that it's just the things you do by yourself. Sometimes self-care is knowing that you need somebody else's help or, whatever external thing that you might need in the moment. So don't let that deceive you. You're not alone and you don't have to do it on your own.
Yeah.
I could just,
I'll go ahead, jump in.
Oh, I just wanted to jump in and reiterate that as well, that it's so important, sometimes we might feel this burden of, I got to figure out my self-care and there is a personal responsibility, but it's also a community and a support that's going to help you. So if you find you are struggling to implement the self-care, as Dr. Thompson was saying, then that could be a good time to get that professional support and help you figure out kind of smaller strategies to begin with. And also if you are a parent or you have caregiving responsibilities, kind of looking for support for your entire family, And then doing wellness activities together can be a great way to implement self-care that's going to be feasible with your current roles in life.
Yes, I think that, yeah, I think the general message here is to kind of check in with who and where you are in life, and seek the appropriate support response that calls for where you are. I know for me, I tend to be a more quiet person. I like to write, I like to play guitar, kind of like do my own little contemplative thing. But there are some times when I just, especially when I was a little younger, where I just, I needed to go out to the club and feel the bass. It wasn't the people thing. I just wanted to feel the music bumping in my chest. And the only, and so for me, that was self-care. That was very supportive. Although that wouldn't be my primary self-care routine. Things like that can be flexed in as self-care. All right. Let's just briefly talk about levels of stress, because I'm sure we all experience it at some time. And the idea here, I think, is not to get rid of all stress. The idea is to how are we going to manage stress? Because stress can be actually a very positive thing as well as toxic. So just to briefly, positive stress is this idea of it's called eustress. It's a brief increase in your heart rate, mild elevation in stress hormone. The panelists here, we may be experiencing a little bit of positive stress, just kind of to make sure we're in the right mood, mindset to present and to get things going. Also, tolerable stress is a more serious temporary stress response that is buffered by supportive relationships. So maybe you have a challenging work environment, but you can go home, you do your thing with the candles and aromatherapy, or you have supportive family relationships that can kind of help buffer the stress that you might experience at work or somewhere else. So that kind of puts you in more of a neutral zone. You can live with it, but it's not necessarily going to help you improve. It's not necessarily going to take you down either. So it's more of a neutral area. Some people have mentioned how homelessness can be a form of tolerable stress. Not that necessarily you'd want to be homeless, and it may not necessarily cause harm, but it's not necessarily a place that I would want to stay for a long period of time. So that's kind of an example of tolerable. But here, supportive relationships is really key with managing the stress. Finally, there's toxic stress. This is where it's the red zone. You might need to get some help here. This is the prolonged activation of stress response systems in the absence of protective relationships. So you're under the stressor for a prolonged period of time. We went through the pandemic and quarantine. That put a lot of stressors on people's minds. Now, I think a lot of stressors are about coming, re-emerging back out to the work world, reintegrating with people. And so how do you manage this prolonged activation of stress? So if you have the stress without protective relationships, it can become toxic and set off a whole series of hormonal issues with cortisol going through your system, and it leads to heart disease and also mental health diseases as well. So the idea here is to look for supportive relationships, protective factors to buffer against the stresses you're facing. And if you're able to, try to remove yourself from the stressful situations as much as possible. And finally, just a quick idea here with the Yerkes-Dodson curve, where it's okay to have a little stress. Where some stress keeps you awake, keeps you going. It's good to have little anxiety right before a test, just to kind of bump your energy level and make sure you're in tune. But if you have too much stress, you won't perform as well. You'll maybe what's the word, choke, where you just kind of lock up and you forget everything that you spent all night studying for. At least for some people, they study all night. Others, they spend the month studying. Likewise, if you have too little stress, it's going to lead to poor performance, so lower arousal leads to lower performance on that end. So you want to find the Goldilocks zone, that medium area where you have you're comfortable enough to not fall into tunnel vision, but you're also engaged enough so that you're not falling asleep. So it's finding this balance between excitation and laxity. And finally, we're just talking about these stressful events. There are different ways to respond to stress. So just very briefly, one is the more maladaptive way, I believe, would be, or if there's just too many stressors coming at you and you don't have the support system to respond, you might succumb to the stress. That would go into a toxic kind of stress. The second kind of response would be survival with impairment. So maybe you went through an injury, something harmed you. You're getting back to more back to normal, but there's still something lingering, some something remaining. There's also resilience, where you basically, you get knocked down and you get right back up again. You get back up to normal functioning baseline, and that's good. You've recovered. The one that we like to focus on with this kind of like positive movement is, once you've been knocked down, how do you get back up, but then also thrive? How do you emerge from that even better? Kind of, the phoenix rising from the ashes kind of idea. So that's what we'll talk just briefly about with the post-traumatic growth. I think I'm going to hand it off.
Yes, absolutely. So again, honing in on that response piece. How are you responding and how are you coping with your stress? And again, it's important to emphasize that everyone's coping and response journey is going to look different. The way that one person copes is going to look different from someone else. Your needs are individualized, just as your self-care regimen is individualized. So again, consider common reactions to stressors you may encounter from the public, home, family, loved ones, your work environment, students, clients, within yourself. And so really speaking to what we mentioned earlier about how there's this transaction between stressors, and really just thinking through from whom, where, and when am I experiencing this stress, and how am I responding to it? And it goes for the same way. How in the public, how in my home, with my family, with my loved ones, with students, clients, within myself, how am I responding to this stress? And think about it. Think about the frequency, the intensity, and the duration of your response and the way that you're coping, because the duration of one coping technique or one place or way that you cope in one circumstance, it might look different compared to another, depending on what that stressor is. So the way that you cope in public might be different from the way that you cope at home. So thinking about, again, what this is going to look like for you among different circumstances.
And I could jump in here. So we'll talk about burnout and then moving a little more to post-traumatic growth. This is especially relevant to people who work in clinical settings or as nurses, but parents can experience burnout and people in other fields too. So if you notice emotional exhaustion, feeling cynical, not being able to think of others as people, kind of seeing them as a problem. And if you feel a lack of personal accomplishment, those are some signs of burnout to be aware of and to take steps to get support. And burnout is typically defined as the process of physical and emotional depletion resulting from conditions at work, or more concisely, prolonged job stress. And it's related to chronic emotional and interpersonal stress. So being aware of that, and we want to implement self-care to try to avoid that. And what can we do in the short term to reduce impacts from stressors? Establishing respectful and supportive rapport. This is particularly if you're working with others, but also for yourself, normalizing your own stress and grief reactions. Some people may have lost loved ones or family members in the pandemic, or maybe struggling with other forms of loss. So understanding that having a feeling of loss and going through the psychological process of grieving is very important, and finding support for that if that is your situation. And using a positive asset search. This is looking at your strengths and resources. You can work with others with this and also for yourself. And if you're struggling to see your own strengths and resources, that's when talking with a counselor or another mental health professional could really help you. We're going to be doing some contemplative techniques today, and these can also be used in therapy to help clients. And also, normalizing angry feelings, but avoiding behaviors that you're going to regret, anger-driven behaviors that can harm others. And if you're struggling with anger yourself, that's another time to maybe seek out a counselor. Therapeutic lifestyle changes is really the heart of self-care. It's looking at how is my lifestyle now, and is it conducive to my own well-being and the well-being of others? And if it's not, then what lifestyle changes can I make? And in the beginning, we talked about values as well. I think Catalina was talking about, if you're here at this webinar, how does this align with your values? So you can also look at your current lifestyle to see, am I prioritizing those practices and activities that are going to be most beneficial, or is something out of alignment that I want to kind of do a course correction? And then one of the key pieces we wanted to bring in was also talking about post-traumatic growth. And that's a very kind of like a big construct, but what we mainly want to mention is that during times of trauma and crisis, and Dr. Eric Thompson mentioned this, there's different things that can occur. Sometimes people can go into distress and may be diagnosed with post-traumatic stress disorder. But there's another alternative. If people get support and can find a way to navigate through that time of crisis, they might have a sense of thriving. They might derive a sense of meaning and have a new sense of purpose that they use. So a traumatic event can be a catalyst for a positive life change and helping others. And so we'll just touch on post-traumatic growth briefly, but thinking about how does that integrate with self-care and wellness. We will be practicing a little bit of meditative practices later. But one thing you can incorporate is mindfulness and self-care and relaxation techniques. So these can help promote workforce resilience and self-care strategies. You can also use this with your own family, and professionals who utilize post-traumatic growth, mental health professionals, are also looking at how to build interconnectedness. So we were talking about some of the social justice advocacy opportunities. We also see self-care as part of that how can we bring communities together to support one another through trauma and crisis and support resilience. And then another way to integrate the post-traumatic growth perspective is to accept change as inevitable. And this aligns with what my co-panelists have been talking about, is to set realistic goals and action plans that you can accomplish and feel good about. And we've also mentioned the idea of wellness breaks. So if you are in a work environment where maybe you're a manager or you have a leadership role, you can help facilitate a culture change towards enhanced wellness in your organization to promote self-care of all your employees as well. And positive coping strategies address both short-term stressors and have long-term positive consequences. Pardon me. So self-care can be considered a form of positive coping. As Dr. Eric Thompson was mentioning, when you do find you're experiencing stressors, we want to find a way to effectively manage those so that they don't get into that level of toxicity. And even you don't want to stay in that tolerable stress for too long. You want to try to manage that. In contrast, maladaptive coping strategies, they might address your perceived stressors in the short term, but they typically lead to a negative effect overall and are associated with higher burnout levels. This was a study of mental health counselors, but the results can be considered with a broader population too, that if we're using substances, that might make us feel less stressed in the moment, but could have a negative consequence overall, particularly if we become addicted to the substance. If we're blaming ourselves for a situation, typically that's going to kind of lead to a negative thought cycle. We're going to feel worse and then have trouble being as effective. So our team has mentioned this as well, but ironically, the times when we're under the high levels of stress and when we really need self-care It's when it's really hard to implement it, when they say, oh, I don't have time, I can't do it. But this is where the seasoning the day theme is so important that Dr. Eric Thompson mentioned. Maybe you're under high stress at work, you have a lot of family obligations and responsibilities. So maybe very hard to carve out 10 minutes. So maybe it's 1 or 2 minutes. Those of you who are working outside the home, maybe you take a time, even while you're driving, to do some deep breathing or to reflect on things that you're grateful for in your life. So sometimes in my life, things get very hectic. So I try to think about, instead of, okay, I'm going to take a long walk today, maybe I look over the week of what could I integrate over the course of this week to care for myself. And some skills related to the facilitation of self-care and wellness. This is a little geared towards clinicians who work with other people, but we can use it to think for ourselves. How are you feeling? If you do take time to, let's say, take a walk, or Catalina mentioned making jewelry, what are you aware of now after you do this? If you take a moment to do your chosen self-care practice or activity. And then also listening to yourself. So if it's hard for you to prioritize self-care because it does feel selfish, maybe you're like, oh, it's a struggle. Then if you reframe it to say, okay, I know I care about others, and I feel that I could probably be more grounded as a parent if I took 5 to 10 minutes for myself. Maybe I do yoga poses. So those are some examples of ways that you could integrate this. I'm not sure if I'm going to hand it off. I think so.
Yes, I can take over. So
okay.
when thinking about integrating self-care, it's important to be intentional. That's what the research says about implementing self-care. It's about being intentional with it, intentional habits of self-care throughout your day. So seasoning the day. And this wellness plan is based off of that self-care model that Catalina mentioned earlier with those 5 selves. So in your plan, within this, you can think about, okay, how do I want to integrate this in my day? What is going to work for me rather than working against you? So again, we want to align your values with your behaviors. You want to do more beneficial activities and do less harmful activities. One of the things Catalina mentioned earlier was that making jewelry, it's a self-care activity for her, but when she does it too much, sometimes it can become a chore. So being able to goal set in an intentional way that's going to work for you. And in your plan, you could choose, if you do a brief needs assessment with yourself, you could say, okay, maybe I'm just going to focus on oneself. This is what I'm going to do right now. That's going to work for me. And then maybe you can build up to focusing on a couple more selves. Again, it's all for you and meant to work with you and for you.
Yes, exactly. Having the plan is important. And this is usually where we would start to pitch or plug some of our workshops and breakout ideas, where we have a personal wellness plan that we actually can help share. So instead of doing that activity right now, I'm going to send my email to y'all. So if you are interested in receiving that plan, feel free to email. I did want to spend a moment here. We've been working with Catalina and Catherine for about a year and a half, maybe even more. I don't even know now. It's been a while, and they've done a lot of work developing self-care. They've done little projects with us, also stemming into other areas. I just wanted to give them a chance to share a little bit about what they're doing before we move on to some more experiential stuff. because they're really stealing the show here anyway. Go ahead, take it.
Sure. So Catherine and I started something called the Feel Good Flyer, which if you go to the next slide, you can see our very first one where we kind of started to break down those 5 selves that we talked about. So it's a little bit of psychoeducation at first, you know, trying to teach you, I guess, the psychology and the science behind why you should kind of consider this as something that you implement. And then if you go to the next slide, you can see where we have stored what was a weekly newsletter. We have kind of slowed down a little bit. Catherine is going on internship and I'm also finishing my program in a bit. So if you do go to our Padlet, and we can put the link in the chat, you'll find curated collections of self-care activities. So each week we focused on one thing. So whether it was, for example, advocacy burnout, you know, after all of last summer, a lot of us were advocating on social justice issues and equality. And so we have the social self and advocacy burnout. We have the creative self, right? So if you remember when I was speaking in the beginning about the 17 subcategories, the creative self had a component for thinking. So what are some thinking related self-care activities? So again, in these PDF files, you'll find links to either tangible things like a journal to keep your thoughts in, or a place on NSU's campus that you can go, like our meditative garden. Or if it's just an actual, hey, follow this activity, it's 5 minutes of deep belly breathing. You might find something that resonates with you. Again, we all change over time. And so what works one day might not work the next, but we give you so many options that I'm sure you'll find something.
Oh, someone just asked how we could find access. We'll post the link in the chat.
Yes.
Yeah, just to briefly cover this. So there's this process that they did. We also put together something for our practicum internship students, and then in the master's program for school counseling and school psychology. So we had a nice little collaboration there. And we ended up creating a Canvas course shell that was kind of an extra training where students would select various self-care activities, they create a plan, and we'd kind of help them through the process. We had, it was met with some success and some other responses, but it was a learning process, and I think a lot came out of it. So we're definitely doing some great work here with self-care. All right, I'm moving on here. All right. So usually we would take a short self-care break, but since we're running out of time, let's just kind of keep going. But anyway, this is where you do like a silly dance, set up stretch. You know, it's really good to stand up and stretch or do something, you know, every 30 minutes to 50 minutes, just kind of get your body moving, keep things fresh. Okay, so I'm going to give you the nutshell version of another hour-long presentation. No, but this I think is useful, and it supports a lot of what we're doing. It puts a meaning within context, within the context of self-care. So, you know, self-care is related to contemplation and mental balance. And so, you know, we have this values reflection that we do. So when you're going through a harder time, you can reflect on your values and kind of redirect where you're going, kind of re-steering the ship. So contemplative traditions, they can offer quite a bit. They focus a lot on human flourishing as opposed to just getting to normal, which has its own value. But this also focuses on, you know, doing exceptionally well. The cultivation of ethical behavior brings forth exceptional mental health. So that's kind of interesting thing to consider. But, you know, you decide what ethics means to you. I'm not going to preach anything there. But, you know, if you are acting in a way that you consider as ethical, for me would be not harming others, for example, somehow that will have an impact on my mental health. I won't feel in danger because I know I'm not harming other people and making them mad that they don't want to harm me. So it's that kind of idea. So the more ethical you become, the stronger the groundwork that you have for exceptional mental health. You can still function without it, but I think you could really excel. Mental distress, and this is from this more contemplative approach. This isn't a clinical model right here. That mental distress can frequently be a symptom of a mental imbalance. And so the idea is to, you know, find that sweet balance spot of not too much, not too little, not wrong. You want it to be just right. So meditation is also a primary means to achieve mental balance, so thereby reducing mental stress. So it's this idea of using contemplation. It could be walking meditation, it could be sitting meditation, or lying down to achieve mental balance. So if you like some of those ideas, there's some things to consider with diversity. Some people may not want to do a contemplative practice, and that's perfectly fine. There's many more things you can do, many more prayers, many other activities, so on. There's an emphasis here on balance, which we talked about quite a bit, and harmony, instead of control and dominance, and that might be off-putting to some. Also, when you would think about diversity, the younger folks are doing these kind of practices, the more concrete you'd probably want to be in the shorter sessions. Also, as they're more mature, they can, and more developed, one can have longer sessions. You have more abstract concepts and things like that. You move from having more active movement to becoming more still, from shorter sessions to longer sessions and things like that. So that's kind of the developmental process there. So I don't want to go too far, but you can use stories and strengths. You can use narratives to help overcome and combat PTSD, and you can link this with the self-care and wellness process. If anyone's interested in that, I'm happy to share more about that offline. So, the very purpose of our life, according to this idea, is, to seek happiness, whether one believes in a religion or not, whether you believe in this or that religion, we're all seeking something better in our life. So the very emotion of our life is towards happiness. So we have, but maybe some of us have different skill sets than others to find that level of happiness. Okay, what else here? So there's a couple approaches. There's the discovery approach where, what am I doing is throwing me out of balance, and there's developmental. What can I do to cultivate balance? So you see, what can I discover myself? What can I cultivate? So just very briefly, there's two types of well-being that I think are really useful in terms of thinking about wellness. One is hedonic. It's stimulus-driven, getting the Lamborghini or getting, a new house, new necklaces. That can be very wonderful. Sensual pleasures can be great. But if that becomes the main focus of your life, some would argue that that can lead to problems. So how do you find a more meaningful life? Well, looking at eudaimonic things, like looking at life as a work in progress, and not necessarily seeing a destination, but kind of enjoying the path. This results from cultivation, and a lot of ethical questions are imperative here. So eudaimonic is it's a happiness that comes from non-stimulus driven processes. So teaching is a eudaimonic process. Raising children can be a eudaimonic process. As opposed to going and enjoying a Snickers bar, which can be hedonic. Both can have their value, but I think the idea here is to have an emphasis on eudaimonia and have hedonic pleasures. Those can be in service to us as opposed to us being in service to them. All right, so I'm going to skip through some of this. There's a whole lot to cover, but I don't want to do all that. So there's mindfulness. Let's just kind of go through one short, brief meditation here. So pardon me for moving fast. I'm going to do the loving kindness one, unless everyone else wants to jump in and do it, or the body scan. No, okay, I'll do it. All right, let's take a deep breath. So the idea here is, a lot of folks tend to go for like a peak spiritual experience right from the start. And, if you do that, it's almost like pouring, milk into a cup that has holes in it. It's just you might have the experience, but it's going to go away very quickly. So one of the things you can do to start cultivating and creating a strong vessel to hold the positivity, the wellness, the self-care results is to start by relaxing. And so we can just kind of do this body scan. I'm going to move from a body scan into a meditation on gratitude and loving kindness. So we kind of see how relaxing a little bit and then moving into the more maybe heartfelt things can be a nice complement to each other, kind of like cheese and wine. Okay, so let's do about 5 minutes, and then we'll just leave it open to chat if you want to speak up, and then we'll call it from there. All right, so I'm gonna pause the sharing of the screen, and I'm gonna pull up. All right, so during the body scan exercise, you pay close attention to the physical sensations throughout your body. So we can all just begin by taking a slow, deep breath, becoming present with what's in front of us, and just slowly exhaling. The idea here isn't to change or relax your body necessarily. You just want to notice and become more aware of what's happening inside your body and around it. You don't want to worry about too much about how long we're going to practice. I've gotten that. I have a clock in front of me. We'll just go nice and slow here. So begin by paying attention to the sensations in your feet. You can notice any sensations like warmth, coolness, pressure, pain, and breathe on the skin. And begin to slowly move up your body to your calves and thighs and pelvis, stomach. Allow that sense of relaxation to move to the chest, the back, slowly working its way up to the shoulders, arms and hands, fingers and neck, finally your head. You can kind of spend some time and go back through those body parts, just noticing any sensations. It kind of makes you wonder, what do you notice when you bring awareness into this equation? As you begin to travel up your body, you can also, when you finish, you can move back down the body through each body part until you reach your feet again. Remember, just to let that sense of awareness flow up, gently flow down as if you're scanning with peaceful, warm, loving awareness into your own well-being. Doing this allows you to become aware of your needs, where you are in the present moment. And if you notice any tension, you can just take a breath and release. Not really targeting anything, just allowing things to let go. Allowing ourselves to have a little space between what we're experiencing and what's there. So as we go through the day, you can allow your awareness to come to rest. And just release any exertion of attending to various objects. So now we're just kind of pulling away from the awareness of the body and just resting in awareness. Just let your awareness come and rest in its own place, neither clinging to anything, nor grasping onto an object. Just resting, calmly abiding. And as you rest in this way, just slowly settle and settle. Imagine resting deeper and deeper, even more clear awareness, pure, open, expanse, luminous, present awareness. And imagine this awareness filling your heart and your body with a light of loving kindness, a figurative light, not a real light. So this impulse, this feeling of caring. And from this vantage point, attend to yourself, this person, finding your way through life, approaching hardship, joy, many different things. A rich history, your own personal history that has formed who you are today. And attend to those experiences in the past in which you've maybe fallen a little short, gone down a little bit, feeling a little depressed, shutting down, maybe mostly self-directed, loss of hope, those kind of things. Note that slippery slope. And while you notice that, you can allow yourself just to momentarily experience that dip of sadness. And as you just kind of dip just for a moment, you can arouse a heart of compassion for yourself. With each in-breath, imagine drawing in that pain, that suffering, and allow it to extinguish. And arouse this heart of compassion for yourself. May I be free. Not free from emotions or from the sadness, but just free of this lingering feeling, this lingering process that debilitates and can lead to despair. With each in-breath, arouse this yearning. May this human being, may I be free of all such impurities. And with each out breath, you can arouse the heart of loving kindness. Let this impulse of caring emanate your heart, from your heart, to be a conveyor of joy, of satisfaction, and delight. Think about your own history when you devoted yourself to virtue, kindness, service, patience, cultivation of wisdom and mindfulness, all the good that is manifested in your life and continues to do so. Not really congratulating yourself, it's just kind of taking delight in that which is truly worthy of delight, something meaningful and worth rejoicing that you may have been a part of. Allow this lovingness, this kindness from your heart saturate your being and attend closely to these virtues and fruits of virtue. The virtues that other helpers have brought to you, people who've cared for you, things that you've brought to others. Just allow that feeling to flow from you out to your friends, your family, to others that you love, those you don't know so well, and maybe even some of those who irritate you at times. You can allow this attention to rove throughout the world, leaping from people to people, expanding infinitely. Bring this light, this caring, this joy, as far and as practically as you can. And as we kind of settle with this thought experiment, you just slowly let those images and thoughts kind of settle back down. Allow that if you're able to create this sense of loving kindness for yourself, this gratitude, go ahead and allow yourself to just let the thoughts go down and then let that experience remain, that feeling of whatever it is you might be experiencing. And when you're ready, you can slowly come out of the meditation. And if you got deep, if you got very relaxed, one way to come out of that is to start wiggling your fingers and your toes, and then you start with your wrists, and you kind of wake up from there. All right, I understand that it's it's 1 minute after, so if you all need to go, I understand. But if there are any chats or any wrap up comments, we are available. Thank you.
Yes, and I do think, Dr. Thompson, a couple people were asking for the PowerPoint and if we were sharing them. I said that if they email you directly, that I think you can send it.
Yeah.
Okay. So there you go to those people that asked.
Thank you, everyone, for participating. We appreciate you being here.
All right, looks like someone cried. They enjoyed it. Yay. Good tears. Thank you. I see a lot of thank yous. Looks like we've covered them all. All right, well, I hope you make it through your hard time. The self-care can be very helpful with that kind of stuff. Mm-hmm. And yeah, I'm here as a resource, so feel free to reach out. We have so many resources and activities and things that we could do. It's unbelievable. So we are here. We're not just the presenters and we're going to drop the mic and walk away. So if you'd like to do more, come reach out to us. We have a whole thing. All right, so I'll stop talking. Thank you very much for your time and your energy and your attention. And I hope to see you around sometime.